The 5 medical checkups I wouldn't EVR get after 60. Men's health. Good day, my friends. If you are over 60 or approaching that stage of life, you've probably noticed something interesting. The older we get, the more people tell us to go for tests, scans, screenings, and medical checkups. It often feels like every year there's a new test someone insists you must take to stay healthy. While medical care is important and prevention can save lives, there's a truth many people rarely talk about. Not every test is always necessary, especially as we age. Medicine is powerful, but it must also be thoughtful. Some tests that once made sense earlier in life may become unnecessary, stressful, or even harmful after a certain age. Today, I want to share 5 medical checkups that many experts say older men should think twice about after 60. This doesn't mean you should ignore your doctor, but it does mean you should understand the purpose of every test before agreeing to it. The first checkup many men should reconsider is frequent full-body CT scans for preventive screening. Some clinics promote these scans as a way to catch hidden diseases early. It sounds reassuring, but the truth is more complicated. A full-body CT scan exposes your body to a significant amount of radiation. When done repeatedly without a specific medical reason, the radiation itself can become a health risk. These scans also often find tiny abnormalities that may never cause harm but lead to anxiety, more tests, and sometimes unnecessary procedures. After 60, the goal should not be chasing every tiny imperfection in the body. Instead, testing should be focused on clear symptoms or medical concerns. The second checkup to reconsider is routine prostate cancer screening with the PSA test when there are no symptoms or risk factors. For decades, men were encouraged to get this blood test every year. But research has shown that PSA screening can sometimes lead to overdiagnosis. Many prostate cancers grow so slowly that they would never cause harm during a man's lifetime. Yet once detected, they may lead to biopsies, surgeries, or treatments that carry serious side effects such as incontinence or sexual dysfunction. For some men over 60, especially those with stable health and no symptoms, the decision to continue PSA testing should be carefully discussed with a doctor rather than done automatically. The third checkup is repeated colonoscopy screenings when previous results have been normal and there are no symptoms. Colonoscopy is a powerful tool for detecting colon cancer, and it has saved many lives. But after 60, particularly if a man has already had several normal colonoscopies, the need for frequent repeat testing may decrease. Colonoscopy is an invasive procedure that carries small but real risks, including bleeding or complications from sedation. Many medical guidelines now suggest longer intervals between tests or stopping them at a certain age if past results were clear. The fourth checkup to question is aggressive heart screening in men without symptoms. Some clinics offer advanced cardiac scans, stress imaging, or calcium scoring as routine checks for older men. While these tests can be valuable for people with symptoms or high risk, they are not always necessary for everyone. Sometimes they uncover mild abnormalities that lead to additional tests, medications, or procedures that may not improve long-term health. After 60, the most powerful heart protection often comes from simple habits: walking regularly, eating balanced meals, managing stress, and maintaining healthy blood pressure. The fifth checkup that deserves caution is excessive hormone testing and testosterone screening without clear symptoms. Many advertisements suggest that every older man should check his testosterone levels as men grow older. Many begin to believe that the more medical tests they take, the healthier and safer they will be. It feels logical. If doctors can look deeper inside the body with modern technology, surely they can catch problems earlier and prevent serious disease. But medicine is not always that simple. In reality, more testing does not always lead to better health, especially after the age of 60. Sometimes, too many medical tests can create unnecessary worry, lead to treatments that were never needed, and even expose the body to risks that outweigh the benefits. Understanding this balance becomes an important part of protecting health later in life. One of the biggest misconceptions about healthcare is that every test is automatically helpful. Many men think that saying yes to every screening or scan is the responsible thing to do. However, medical professionals increasingly recognize a problem called overtesting. Overtesting happens when tests are performed without a clear medical reason or when the potential harm of the test is greater than the possible benefit. As people age, the body naturally changes, and small irregularities often appear in scans or blood work. These irregularities may look alarming, but many of them are harmless and would never cause symptoms or illness during a person's lifetime. When a test detects something unusual, even if it is harmless, it rarely stops there. That small finding can lead to additional scans, biopsies, or procedures. Each step brings new risks and anxiety. A tiny shadow on a scan may trigger weeks or months of fear while waiting for further results. For older men who are otherwise healthy and living active lives, this process can sometimes create more stress than the original test was meant to prevent. Health is not only about physical measurements, but also about peace of mind and quality of life. Another important factor is that many screening tests were originally designed for younger populations. When someone is younger, detecting a disease early may allow many years of treatment and prevention. But after 60, the situation can change. Some conditions grow so slowly that they would never actually affect a person's lifespan. Detecting these conditions can lead to aggressive treatments that bring side effects without adding meaningful years of life. In these cases, the treatment itself can reduce quality of life more than the condition ever would have. For example, certain cancers grow extremely slowly in older adults. A screening test might discover a small tumor that would never become dangerous. Yet once it is found, the natural instinct is to treat it immediately. That treatment may involve surgery, medication, or radiation, each carrying its own complications. A man who felt completely healthy before the test may suddenly face months of recovery or permanent side effects. Situations like this show why thoughtful decision-making about testing becomes more important with age. There is also the issue of physical strain. Some medical tests are simple blood draws, but others involve preparation, sedation, or invasive procedures. As the body ages, recovery from these procedures may take longer, and complications become more likely. What once felt routine in your 40s or 50s may feel far more exhausting in your 60s or 70s. Doctors today increasingly emphasize that testing should serve a clear purpose rather than being done automatically every year. Financial costs can also play a role. Many advanced tests and scans are expensive, and not all of them are fully covered by insurance. Some men spend large amounts of money chasing reassurance through repeated screenings, only to find themselves caught in a cycle of additional tests and follow-up appointments. True health often comes from consistent habits rather than constant medical investigations. The truth is that some of the most powerful health protections are surprisingly simple. Regular physical activity, balanced nutrition, good sleep, and strong social connections often have a greater impact on long-term well-being than many screening tests. Walking daily, managing blood pressure, avoiding smoking, and maintaining a healthy weight can dramatically reduce the risk of heart disease, diabetes, and many other conditions that affect older men. These habits strengthen the body in ways no scan or machine can replicate. Another important part of aging wisely is having open conversations with healthcare providers. Instead of assuming every test is necessary, men should feel comfortable asking questions. What is this test looking for? How likely is it to find something serious? What happens if the test finds something unclear? Understanding these answers helps people make decisions that align with their personal health goals and values. A thoughtful approach to healthcare does not mean ignoring medical advice or avoiding doctors. It simply means recognizing that good medicine is not about doing more, but about doing what truly matters. As men move through their 60s and beyond, wisdom becomes one of their greatest strengths. That wisdom can guide them toward medical choices that protect both their health and their quality of life. Reaching the age of 60 is an important milestone in a man's life. It represents decades of experience, lessons learned, and a deeper understanding of what truly matters. Yet, when it comes to health, many men begin to feel uncertain about what decisions are truly right for them. Doctors, advertisements, and even friends often recommend different tests, supplements, and treatments. With so much information and advice coming from every direction, making smart medical decisions becomes one of the most important skills a man can develop after 60. One of the first steps in making better medical decisions is understanding that health is not only about treating illness, but also about maintaining balance. As the body ages, it naturally goes through changes. Energy levels may fluctuate, muscles may lose strength more easily, and recovery from illness may take longer than it once did. These changes are normal parts of aging, not always signs of disease. Smart medical decisions begin with recognizing the difference between natural aging and a true medical problem that needs intervention. Another important part of wise healthcare is learning to ask questions. Many men grew up in a time when people simply followed whatever the doctor said without discussion. While doctors remain trusted experts, modern medicine encourages patients to be active participants in their care. Asking questions about the purpose of a test, the benefits of a medication, or the risks of a procedure can help men make informed decisions that align with their personal health goals. A good doctor welcomes these conversations because they lead to better understanding and stronger trust between patient and physician. Preventive care continues to play a role after 60, but it should be thoughtful rather than automatic. Screenings for conditions like high blood pressure, diabetes, or certain cancers can still be valuable when they are recommended based on individual risk factors. However, not every test needs to be repeated every year, and not every screening is necessary for every man. Smart decisions involve discussing personal health history, family history, and lifestyle with a doctor to determine which tests truly make sense and which ones may no longer provide meaningful benefits. Lifestyle choices also become even more powerful after 60. Many chronic illnesses that affect older men are closely linked to daily habits. Heart disease, type 2 diabetes, joint problems, and even cognitive decline are strongly influenced by physical activity, diet, and stress management. Choosing to walk regularly, stay physically active, eat balanced meals, and maintain a healthy weight can often do more for long-term health than many medications. Smart medical decisions recognize that the foundation of wellness is built outside the doctor's office through everyday choices. Medication management is another critical area where careful thinking is necessary. Many men over 60 take several prescriptions at once, sometimes prescribed by different doctors. While medications can be life-saving when used correctly, taking too many drugs at the same time can lead to interactions, side effects, or unnecessary complications. Reviewing medications regularly with a healthcare professional helps ensure that every prescription still serves a clear purpose and that none are causing more harm than benefit. Mental and emotional health should also be part of smart medical decisions. Aging can bring life transitions such as retirement, changes in family roles, or the loss of loved ones. These experiences can affect mood, motivation, and overall well-being. Seeking support from friends, family, or professionals when needed is a sign of strength, not weakness. Staying socially connected and mentally engaged through hobbies, learning, and community involvement can protect both emotional health and cognitive function. Another important aspect of wise healthcare is recognizing the value of quality of life. Some treatments or procedures may promise small health improvements, but come with significant discomfort or long recovery times. For many men over 60, the goal is not simply living longer but living well. Decisions about medical care should consider how treatments will affect daily life, independence, and personal happiness. This perspective allows men to focus on what truly matters to them: Building a strong partnership with a trusted healthcare provider can make these decisions much easier. A doctor who understands a patient's history, lifestyle, and personal priorities can provide guidance that goes beyond general medical advice. Regular checkups, honest conversations, and mutual respect create a foundation where medical decisions are made with clarity and confidence. Ultimately, smart medical decisions after 60 come from a combination of knowledge, communication, and self-awareness. Instead of reacting to every new health trend or worrying about every possible illness, men can focus on what genuinely supports their well-being. By staying informed, maintaining healthy habits, and working closely with medical professionals, they can navigate the later years of life with strength, independence, and peace of mind.